All right, future doctors, get ready. We're diving deep into forensic medicine today.
Yeah, always a fascinating topic.
Picture this. You're an ER doc,
Uh-huh.
place is packed, adrenaline's high,
Sure.
and a patient comes in, you think maybe poisoning. What's the first thing you're thinking?
Gotta think fast, gotta be systematic.
Right.
You need to treat them right away, obviously.
Of course.
But also gather all this information,
Okay.
Could be super important for treatment, but also, legal stuff.
It's like you're a medical detective.
That's a good way to put it.
Our sources actually talk about this case.
Okay.
17-year-old girl took like 25 paracetamol tablets.
Oh, wow.
High stakes.
Definitely.
So let's break it down step by step.
Sure.
How do you, as a doctor, tackle a possible poisoning?
First thing is emergency assessment
Right.
and taking their history. Gotta ask the right questions.
So it's not just the medical stuff.
No.
You got to be a good communicator, observe everything.
Exactly. Every little detail could be important.
What are the must-ask questions?
Well, you need to know what happened. The who, what, when, why.
Okay.
Like, what did they take?
Uh-huh.
Was it just one thing or a bunch of drugs?
Oh, right.
Then how much?
Okay.
That can be tough, though.
Why?
Patients aren't always reliable.
Right. Especially if it wasn't an accident.
Exactly.
And when do they take it? That matters too, right?
Oh, for sure. That helps you predict how bad it might get.
And you said why?
Yeah, what were the circumstances? Was it an accident?
Uh-huh.
Was it on purpose? Or maybe, something else?
So it's like you're a real investigator.
Yeah,
It's not just about treating them. You got to figure out if maybe the police should be involved too.
could be. Yeah.
Wow. Okay, so what's next?
Well, next you got to do a physical exam. This is where your clinical skills come in.
All right, so what are you looking for? It's like you're searching for clues.
Absolutely. First, how conscious are they?
Okay.
Are they alert, sleepy, unresponsive?
Yeah, I get it.
Then you check their breathing.
Right.
How fast, how deep, any signs they're struggling.
Oh, yeah.
Temperature, too. That can tell you if there's an infection or if the toxin is messing with their metabolism.
Can I just say, I can just picture the ER,
Yeah.
all the activity.
It's a busy place.
It is so much going on.
But you got to stay focused. Check their pulse, blood pressure. Some poisons can really mess up your heart.
Makes sense.
Yes.
What else?
Don't forget the pupils, dilated, constricted, different sizes, could be certain drugs.
Wow.
And you got to check their muscles, their reflexes.
Okay.
Some toxins can make you weak, paralyzed, even have seizures.
So, like, the body is kind of talking to you.
In a way, yeah. Each sign could be a clue to what's going on.
But the physical exam is just the start, right?
Yeah.
What about lab tests, like investigations?
Right. So once you have an idea of what might be going on, you can order some tests.
Okay.
Like if you think it's paracetamol, salicylate, or lithium, you'll need to check their blood levels.
Makes sense.
Our sources also talk about toxicological screening. You can do that with blood and urine.
What's that?
It's like getting a chemical fingerprint.
Oh, I see.
Helps you identify drugs or toxins that aren't as common.
That's really cool.
Yeah, it's important. But we don't stop there. You got to check how their organs are doing, see if there are any complications.
So what kind of tests?
Depends on what you suspect, but could be things like blood gas analysis, checking their clotting,
Right.
liver function tests, electrolytes, creatinine for their kidneys, an ECG, full blood count, even a chest x-ray.
So you're using, like, everything you can, the patient's history, the exam, all these tests?
You have to.
Wow, it's like detective work, but at a, like, cellular level.
Pretty much.
Amazing. Now, let's go back to our case.
The 17-year-old girl with all the paracetamol.
That's right. This brings us to paracetamol poisoning. Really important for medical students to understand.
Yeah, paracetamol is everywhere.
It is.
Easy to forget, it can be dangerous.
Very dangerous if you take too much.
Right. Normally, your liver can handle it just fine.
Okay.
But if you take too much, it overwhelms your liver.
Oh.
It can't break it down properly.
What happens then?
This toxic metabolite builds up called NAPQI.
NAPQI.
Yeah, that's when things go bad. NAPQI attacks the liver cells, causes serious damage.
Our sources say it's really important to know the difference between a safe dose and a dangerous dose.
Absolutely. Essential knowledge for any doctor.
So what's a dangerous dose?
For adults, anything over 10 grams at once, or over 200 milligrams per kilogram of body weight.
Wow, that's good to know. So there's this Rumac-Matthew nomogram, right, that helps figure out if someone needs treatment.
Exactly.
How does it work?
Well, you plot their paracetamol blood level against the time since they took it, and that helps predict the risk of liver damage.
I see.
and tells you if they need the antidote,
Which is?
N-acetylcysteine or NAC.
Okay. So what about the stages of paracetamol poisoning? What should med students know about that?
So the first 24 hours after a toxic dose, they might not have any symptoms. Or
Really?
just mild stuff like nausea, vomiting.
But it could be serious.
Oh yeah, serious damage could be happening even if they feel okay.
That's scary.
It is. Then between 24 and 72 hours, you start seeing signs of liver damage.
What kind of signs?
Pain in the upper right part of the belly, liver enzymes go up, maybe jaundice.
And if you don't treat it?
It can progress to liver failure.
Wow.
And that's really bad. Between 72 and 96 hours, things can get really serious.
Yeah.
Bleeding, brain problems, kidney failure, even problems with their blood clotting.
So you really have to catch it early.
You do. It's a race against time.
Absolutely.
All right.
Okay, let's talk about treatment.
Yeah.
Specifically, antidotes.
Okay.
Those are fascinating. Like substances that reverse the poison.
They can be pretty amazing, yeah.
Our sources talk about a few, like
Yeah.
NAC for paracetamol,
Yep.
glucagon for beta blocker overdose,
Uh-huh.
and something for digoxin toxicity.
Digoxin-specific antibody fragments.
Right. It's like having a specific weapon against the poison.
A targeted weapon. NAC is a good example. It basically helps the liver fight back.
Okay.
It gives the liver more glutathione.
Glutathione.
Yeah, it's a substance that helps neutralize that toxic NEPQI we were talking about.
So it's not just blocking the poison, it's helping the body fight it.
Exactly.
So smart. What other ways can you manage poisoning?
Well, you can try to stop the body from absorbing more of the toxin.
How do you do that?
Things like gastric lavage, which is basically stomach pumping,
Oh, right.
or activated charcoal,
I've heard of that.
or even whole bowel irrigation.
Whole bowel irrigation. What's that?
It's basically cleaning out the entire digestive system.
Wow.
Sometimes you can make the body get rid of the toxin faster.
Okay, how?
For some drugs, you can make the urine more alkaline. That helps flush them out. And for really serious cases, you can use hemodialysis.
Hemodialysis. So you're filtering the blood directly?
Right.
Amazing. So many tools to fight poisoning.
It's a whole arsenal. But it's not just about those things.
What else?
Supportive care is crucial. Make sure they're breathing okay, their heart is stable, fix any electrolyte problems, give them pain relief, and treat any complications that come up.
So you're looking at the whole patient,
You have to.
not just the poisoning.
Exactly. And in cases of overdose, you also need to consider their mental health.
Right, like why did they do it?
Exactly. Treating the underlying mental health issues is just as important.
That makes sense. Okay, so we've talked about the initial assessment, the investigations, paracetamol overdose, and all these different treatment strategies.
A lot of information.
It is, but paracetamol's just one example.
Guys.
There are tons of other drugs out there.
Tons.
So many different ways people can be poisoned.
Absolutely. Every poison is different.
What other common poisonings should medical students be aware of?
Let's start with benzodiazepines. Those are pretty common. Prescribed for anxiety, insomnia. If you take too much, you can get really drowsy, have problems with coordination, slurred speech, even have trouble breathing.
It's like the normal effects, but amplified.
Yeah, basically.
Is there an antidote for that?
There is. It's called flumazenil,
Ooh.
but we don't always use it.
Why not?
Sometimes it can actually make things worse.
Oh, wow. So antidotes aren't always the answer.
Yeah, not always.
What about antidepressants?
Those are tricky too. You
Yeah.
have tricyclic antidepressants, or TCAs,
Okay.
and selective serotonin reuptake inhibitors, SSRIs.
Yeah, those are both really common.
They are. TCAs can be really dangerous in overdose. Can mess up your heart rhythm, cause seizures, even coma.
So you need to monitor their heart closely.
Yeah, with an ECG.
Right. What about SSRIs?
Those can cause something called serotonin syndrome.
What's that?
Basically, too much serotonin in your system
Okay.
can be life-threatening. Symptoms are agitation, confusion, tremors, muscle rigidity, fever.
Sounds pretty bad.
It is. Then there are opioids, of course.
Mm.
Powerful painkillers.
Yeah, they can be dangerous.
Very dangerous. Overdoses can cause pinpoint pupils, slow breathing, decreased consciousness.
But there's an antidote for that, right? Naloxone.
Yes, naloxone is a lifesaver. Reverses the effects of opioid overdose pretty quickly.
That's good.
But it can cause withdrawal symptoms.
Oh, right, if they're dependent on opioids.
Exactly. So you got to be careful with it.
What about digoxin?
Digoxin is another one to watch out for. It's used for heart failure.
Right.
In overdose, it can cause irregular heartbeats, confusion, nausea, vomiting.
So problems with the heart again.
Yeah, it's a common theme with a lot of these drugs.
Makes sense.
There's actually a specific sign you can see on an ECG with digoxin.
Really? What is it?
It's called the reverse tick sign. You can see it even with normal doses, but it's more pronounced with toxicity.
That's cool. So the ECG can give you a clue.
It can. Luckily, we have a specific antidote for digoxin.
What is it?
Digoxin-specific antibodies. They basically bind to the drug and remove it from the body.
That's amazing.
Hmm.
What about salicylates?
Those can cause a lot of problems.
Like what?
Metabolic disturbances, tinnitus, deafness, seizures, even coma.
Wow, that's a lot. What kind of metabolic disturbances?
Metabolic acidosis, respiratory alkalosis. It's a complex picture.
And how do you treat that?
Can use activated charcoal to reduce absorption,
Uh-huh.
and you can alkalinize the urine to help get rid of it faster.
Okay.
And for severe cases, hemodialysis can be life-saving.
So many different things to consider. What about lithium?
Lithium's interesting. It's a mood stabilizer used for bipolar disorder.
Yeah, I know about that one.
The problem is the difference between a safe dose and a toxic dose is pretty small.
Oh, so it's easy to overdose.
It can be. And when you do, it can affect a lot of different organs. Tremors, confusion, seizures, coma, even death.
That's scary. So you have to monitor their blood levels really closely.
You do. Regular blood tests are essential. And if they do overdose, you need to support their organs, keep them hydrated, and sometimes use hemodialysis to remove the lithium.
It sounds like managing poisoning cases requires a lot of knowledge and quick thinking.
It definitely does. You have to be able to assess the situation quickly, order the right tests, and make treatment decisions based on the best available evidence.
It's a lot of responsibility.
It is, but it's also incredibly rewarding.
Yeah.
Knowing that you can use your knowledge and skills to save someone's life or to help them recover from a serious illness is an amazing feeling.
Absolutely. Okay, so we've covered a lot in this first part of our deep dive.
We have.
From the initial assessment to the investigations, the specifics of paracetamol overdose, and a quick overview of some other common drug toxicities.
It's a lot to take in.
It is, but it's so important for medical students to understand.
It is. And this is really just the beginning.
There's so much more to learn about forensic medicine.
Definitely. But I think we've laid a good foundation.
I agree. We've given our listeners a taste of what this field is all about.
And hopefully sparked their interest in learning more.
Absolutely. It's a fascinating field and one that's constantly evolving.
And one that offers endless opportunities for those who are drawn to it.
Okay, so let's take a quick break, and when we come back, we'll continue our exploration of forensic medicine.
Sounds good.
We've covered so much already,
I know, right?
but we're just getting started.
Just scratching the surface.
Forensic medicine is so, it really makes you think differently.
It does. For med students, it's not just about memorizing facts.
No.
You got to be able to look at things, observe, ask the right questions.
Be critical.
Exactly.
Okay, so we talked about poisonings,
Right.
how to recognize them, how to treat them.
Uh-huh.
But there's another big area in forensic medicine that's especially relevant for future doctors.
I know what you're going to say.
Well,
Forensic pathology.
that's right.
The detectives of the dead.
I love that.
They investigate deaths that are suspicious,
Yeah.
like was it a murder,
Yeah,
suicide, an accident,
right. Right.
or even if it seems natural but something's not quite right.
Yeah.
That's where the forensic pathologist comes in.
Our sources have some great stuff about this. It's really interesting.
Oh, yeah, it's fascinating work.
Okay, so imagine this.
Okay.
A young woman found dead in her apartment.
Uh-huh.
No obvious signs of injury. No witnesses, no note.
It's a mystery.
It is. And that's when you call in the forensic pathologist.
Exactly.
So they're like examining the body, looking for clues.
They're like medical detectives, yeah.
I like that.
Yeah.
So what do they actually do?
Well, first, they examine the body externally,
Okay.
very carefully, looking for any tiny injuries, needle marks, anything unusual.
Wow.
They're basically reading the body like a map, looking for any markings that might tell them something.
That's crazy.
It's detailed work.
What happens after that?
Often, they'll do an autopsy.
Oh, right.
That's a surgical exam of the body,
I see.
to look at the organs and tissues.
Okay.
See if there are signs of disease, injury, or any drugs or toxins.
So they're going deeper, like under the surface.
Exactly. They're looking for clues that the body itself might hold.
And they take samples
Right. They do. Blood, urine, tissues.
for testing
Right. Toxicological analysis.
to see if there were drugs or poisons.
Uh-huh.
It's amazing how much you can learn from the body, even after death.
It is. Science is a powerful tool.
It is. But sometimes the findings are unexpected.
Oh, yeah. Sometimes what you think is a natural death turns out to be something else entirely.
Like what?
Could be poisoning. Or a suicide that was actually staged.
So you can't always trust appearances.
No, you can't. Sometimes the truth is hidden.
And it takes a skilled forensic pathologist to find it.
It does. They need a deep understanding of the human body.
Anatomy,
Physiology.
all that stuff.
And pathology, toxicology. It's a lot of expertise.
It is.
Yeah.
So for med students who might be thinking about pathology,
It's a challenging field, but so rewarding.
definitely something to consider.
Okay, let's switch gears a bit.
Okay.
Let's talk about another area where forensic medicine is really important.
What's that?
Sexual assault investigation.
Oh,
It's a sensitive topic, but every future doctor needs to know about it.
it's true. We have a responsibility to care for victims of sexual assault.
Absolutely. And part of that is understanding the forensic side of things.
Our sources talk about the medical exam.
Yeah, it's a crucial part of the process.
Okay, so for our listeners, what do they need to know?
So when a victim comes in to the ER or a clinic,
Uh-huh.
that medical exam can be really important
Okay.
for healing, for justice.
But it's also a really delicate situation.
It is. You're dealing with someone who's been through something horrible.
Yeah,
You have to be so empathetic, so respectful.
absolutely. So how do you approach the exam?
The victim has to be in control. Always.
Okay.
You explain every step, get their consent before you do anything.
Right.
Their comfort and well-being come first.
And the exam itself, is it pretty thorough?
It is. It's a head-to-toe assessment.
Okay.
You're looking for any injuries, collecting evidence, and also giving them preventative treatment.
Preventative
Yeah.
treatment.
Yeah, for STIs and pregnancy.
Right, of course.
So it's medical care, evidence collection, and respecting the victim's autonomy, all at the same time.
A lot to balance.
It is. But it's important to remember that even if there are no visible injuries,
Uh-huh.
that doesn't mean the assault didn't happen.
Right. It's not just about physical harm.
Exactly. Sexual assault is about power and control.
So you can't judge based on just the physical evidence.
No, you can't. That's why it's so important to listen to the victim.
Right.
Document their story carefully. Treat their experience with respect.
Their voice matters.
It does, more than anything.
What about collecting evidence? What kind of things do you collect?
Well, it depends, but it could be clothing, hairs, fibers, bodily fluids,
All right.
anything that might have the perpetrator's DNA.
And all that has to be handled really carefully, right?
Oh, absolutely.
Ah.
Strict protocols, everything has to be labeled and packaged correctly.
To avoid contamination.
Right. And to make sure it's admissible in court.
Because this evidence could be what puts someone behind bars.
It could be, yeah. DNA is very powerful evidence.
It is. It's amazing how science can help in these situations.
It is. But it's not just about collecting evidence.
What else?
You have to provide support for the victim.
Right.
Emotional support. Connect them with advocacy services, counseling, follow-up care.
It's about treating the whole person.
Exactly. The trauma goes beyond the physical. It affects them emotionally, psychologically.
And healing takes time.
It does. And everyone heals differently.
It's a long journey.
It is. But forensic medicine can help
Wow.
by providing compassionate care, collecting evidence, and helping them get justice.
So they can reclaim their lives.
That's the goal.
Okay, let's move on to something a bit different.
Okay. What do you have in mind?
Our sources talk about disaster victim identification.
TVI. Yeah, that's a whole other area of forensic medicine.
It's pretty intense, like after plane crashes, earthquakes, those kinds of things.
Mass casualty events. It's not something you want to think about, but it happens.
It does. And someone has to identify the victims.
That's where DVI comes in.
It sounds really complicated.
It is. It involves a whole team of experts.
Like who?
Forensic pathologists, anthropologists, odontologists, DNA analysts, fingerprint experts.
Wow.
They all work together.
It's like a forensic dream team.
You could say that.
And it must be really hard emotionally.
Oh, it is. Dealing with so much death, so much trauma.
Yeah.
But the goal is to identify the victims, give their families closure.
That's so important.
And the information is important for legal reasons, too.
Okay.
Like insurance claims or if there's a criminal investigation.
So how do they actually identify the victims?
It's a multi-stage process. First, they secure the disaster site
Right.
and start recovering the bodies.
I can't imagine doing that job.
It's tough, but it has to be done.
Okay, so then what?
The bodies are taken to a temporary mortuary,
Okay.
and that's where the identification process begins.
So how does that work?
They collect antemortem data.
Antemortem data.
Yeah, that means information about the victims before they died.
Oh, I see.
So things like photographs, dental records, medical records, fingerprints, DNA samples.
Right, from family members or their belongings.
Exactly. They're building a profile of each victim.
And then they examine the bodies.
They do. Postmortem examinations, looking for any identifying features, injuries, anything unique.
Like tattoos, scars, those kinds of things.
Exactly. And this is where the specialized skills of the team come in.
Okay, tell me more.
So forensic anthropologists, they can analyze skeletal remains.
Even if the body's, like, decomposed.
Even then, they can tell you the age, sex, ancestry, height of the person.
Wow.
Odontologists can compare dental records.
To identify them by their teeth.
Exactly. And then you have fingerprint experts, DNA analysts,
Right.
all working together to match the postmortem data to the antemortem records.
It's incredible how much they can do.
It is, but it's not always a quick process. Sometimes it can take weeks, months, even years.
Wow.
But the team is committed to getting those answers for the families.
It's a tough job, but so important.
It is. It's really about bringing peace to those who are grieving.
Okay, so we've talked about identifying the dead.
Right.
But forensic medicine isn't always about that, is it?
No, it's not. There's a whole other side to it.
What's that?
Think about the doctor as an expert witness.
Oh, right.
That's something that medical students might not think about.
Yeah, it's not something you usually learn about in med school.
It's not, but it's a real possibility.
So, like, a doctor can be called to testify in court?
They can.
About what?
All sorts of things. Medical malpractice, personal injury, criminal cases,
Wow.
assaults, poisonings, even deaths.
So they're basically explaining the medical evidence to the court.
That's a good way to put it.
Like a translator.
Yeah. They're there to provide objective, unbiased testimony.
Based on their expertise.
Exactly.
That sounds like a big responsibility.
It is. And it requires a lot of preparation.
Like what?
They need to understand the legal process, the rules of evidence.
So it's not just about medicine.
No, it's not. They also have to be able to explain complex medical concepts in a way that anyone can understand.
That's a skill in itself.
It is. And they have to be able to stay calm under pressure.
Because they'll be questioned by lawyers.
Exactly. Cross-examination can be tough.
I bet.
But for doctors who are well prepared, it can be a rewarding experience.
How so?
It's a chance to use their knowledge to help the legal system work fairly.
To ensure that justice is served.
Exactly.
So it's like another way that doctors can make a difference.
It is. It's a reminder that the practice of medicine extends beyond the exam room.
Into the courtroom.
Exactly.
So we've seen how forensic medicine is involved in investigating death, crime, protecting victims, and even the legal system.
It's a broad field.
It is. But before we wrap up this part, there's one more thing we need to talk about.
Okay, what's that?
Informed consent.
Ah, yes. A very important topic.
Especially in forensic medicine.
It can get complicated.
So for our listeners, how is informed consent different in forensic medicine?
Well, in a normal clinical setting, informed consent is pretty straightforward.
Right.
You explain the risks and benefits of a treatment, and the patient decides what they want.
Okay.
But in forensic medicine, sometimes the patient isn't your main concern.
What do you mean?
Like, if you're examining a suspect in a criminal case, your primary responsibility might be to the legal system, not to that person's well-being.
That's a tough situation.
It is. You have to balance those competing interests.
So how do you handle that ethically?
You have to be very transparent. Explain to the person why you're examining them, what you're going to do, how the information will be used.
And what happens if they refuse?
You have to tell them that too, what the consequences might be.
So even though they're not your typical patient, you still have to respect their rights.
Absolutely. Everyone has the right to know what's happening to them.
And informed consent isn't just a one-time thing, right?
No, it's an ongoing process.
What do you mean?
The situation might change, new information might come up, the person's understanding might change.
So you have to keep checking in with them.
You do. Make sure they're still okay with everything.
It's about being flexible and responsive.
Exactly. And if you're dealing with a child or someone with a cognitive impairment, it gets even more complex.
I can imagine.
You might need to involve parents, guardians, legal representatives.
To make sure their rights are protected.
Right.
So informed consent in forensic medicine is a delicate balance.
It is. Legal, ethical, and clinical considerations all come into play.
Wow. So much to think about.
There is, but at the end of the day, it's about respecting everyone involved, making sure they understand what's happening.
That's really important.
It is. Okay, so we've covered a lot in this part. Poisonings, forensic pathology, sexual assault investigation, DVI, expert witness testimony, and informed consent.
My brain is full.
I know, right? It's a lot to take in.
It is.
Yeah,
But it's also fascinating.
it is. Forensic medicine is a truly captivating field.
It is. And we're just getting started. It's amazing, right, how forensic medicine is like everywhere.
Yeah.
We talked about poisonings, forensic pathologies, sexual assault, disaster victim identification, being an expert witness, informed consent.
Lots of ground covered.
It is, but it's important to remember forensic medicine isn't just about, like, death and disasters.
That's right.
It's about the living, too,
Absolutely. It's about understanding people.
their behavior,
Yeah, and what those behaviors can lead to.
the consequences.
Exactly.
Med students need to get this.
It's crucial.
There's not just the science.
Well,
You got to be observant.
you do?
Like, read between the lines.
See the bigger picture.
So you're like a detective, right?
Always looking for clues.
Trying to figure out what
She's
happened.
a big part of it, yeah.
Okay, so give me an example.
All right, imagine a patient comes in with, say, fatigue, unexplained weight loss, stomach problems.
Could be a lot of things.
It could, but could it be poisoning?
Oh, right.
Chronic poisoning, maybe something in their environment,
Like what?
exposure to heavy metals, toxins at work, something like that?
So it's not just dramatic stuff.
No.
It's about these subtle signs.
Yeah,
Connecting those signs to, like, what's going on in their life.
exactly. And then advocating for those patients.
Because sometimes they don't even know they're being poisoned.
That's right. And that's where the doctor's role as an advocate is so important.
Okay, I like that.
We're not just treating individuals,
Well,
we're looking out for whole communities.
Trying to prevent harm.
Exactly.
So it's like you're using your knowledge to make the world a better place.
That's a good way to put it.
I like that. Okay, so as we wrap up our deep dive into forensic medicine,
It's been a journey.
it has.
Hmm.
What's the one big thing our listeners should take away?
I think the most important thing is this. Forensic medicine, it's not just a specialty.
Okay.
It's a way of thinking.
A mindset.
Yeah.
How so?
You got to have that attention to detail,
Uh-huh.
that thirst for knowledge,
Wanting to know the truth.
and a commitment to justice.
So you're like a detective, a scientist, an advocate,
All of those things.
but also a healer.
You can't forget that part?
No,
Hmm.
because at the end of the day, it's about people.
It is. It's about understanding the impact our choices have on each other.
And using medicine to, like, solve mysteries,
Right.
to heal, to bring closure.
Well said.
So for our med students out there,
Just starting out.
don't be afraid of this field.
Embrace the challenges.
It's complex,
It is.
but so rewarding.
Definitely.
There's so much to learn, so much to discover.
And you can make a real difference.
So keep learning, keep questioning,
Keep exploring.
and never forget the human side of it all.
That's the most important part.
Well said. And maybe one day, you'll be the ones leading the next deep dive.
Passing on the knowledge.
Exactly. All right. That's it for this deep dive. We'll catch you next time.
See you then.